How do anatomical silicone implants differ from round implants aesthetically? Imagine the difference between a natural teardrop and a perfectly round ball. That's essentially what sets anatomical silicone implants apart from round ones in breast augmentation. Anatomical implants, often called teardrop implants, are shaped to mimic the natural contour of the breast. They are tapered at the top and fuller at the bottom, creating a gentle slope that resembles a real breast's natural shape. This design helps achieve a more subtle, natural look, especially when the patient has thin tissue or desires a shape that closely resembles natural anatomy. Round implants, on the other hand, are symmetrical and uniformly round. They tend to add fullness evenly across the entire breast, but especially in the upper pole, giving a more augmented and dramatic appearance. This fullness in the upper part of the breast can create a more prominent cleavage and a more noticeable, rounded silhouette. Many patients choose round implants if they want a fuller, more pronounced look, or if they prefer a less complex surgical procedure. When it comes to how the implants distribute volume, anatomical implants focus their fullness in the lower part of the breast, which is ideal for patients looking for a natural shape or needing correction of sagging or asymmetry. Round implants provide more uniform volume, which enhances the upper breast and can give a more lifted appearance. Because of this, round implants often produce a more dramatic and noticeable result. The surface texture also plays a role. Anatomical implants usually have a slightly textured surface to help them stay in place and prevent rotation. Since their shape is directional, a rotation can distort the breast's natural look. Round implants are often smooth and do not have this issue because their shape is symmetrical, so rotation does not change their appearance. Feel is another difference. Anatomical implants tend to be firmer, which helps maintain their shape and allows for better contouring. Round implants are generally softer and move more naturally with body movements, which some patients find more comfortable and natural feeling. Choosing between these two types depends on individual goals. Anatomical implants are great for those wanting a natural, teardrop shape, especially if they have thin tissue or want to correct shape issues. Round implants are popular for patients seeking a fuller upper breast, a more dramatic look, or a simpler surgical process. Surgeons need to be precise with anatomical implants to prevent rotation and ensure proper placement, while round implants are easier to position and less technically demanding. In summary, anatomical silicone implants give a more natural, teardrop shape with volume concentrated at the bottom, ideal for a subtle look. Round implants produce a fuller, more rounded breast with emphasis on the upper pole, creating a more pronounced, augmented appearance. Both options can deliver beautiful results when chosen carefully based on the patient's anatomy, aesthetic goals, and the surgeon's expertise. Always consult with a qualified plastic surgeon to determine the best choice for your individual needs.